I just want to thank you beforehand for coming and watching me do my presentation on alcohol. So during my presentation, I have two handouts. One is a word search and one is a true or false. If you'd like to complete those, that'd be great. So I'm doing a presentation on alcohol for my psychopharmacology class. Let's get started. So let's start with the history and origin. The history and origin about alcohol. In China, around 7000 BC, there was evidence of early alcoholic beverages. In India, between 3000 and 2000 BC, an alcoholic beverage called sura was created. In Greece, the first alcoholic beverage was called mead. Mead was made out of water and honey. And then alcohol spirits were largely used in the 16th century for medical purposes. The substance compound of alcohol. Alcoholic beverages, including wine, beer, coolers, ciders, etc., contain ethanol alcohol. This ethanol alcohol is used as an intoxicating agent. Alcohol belongs as a depressant. It is classified as a depressant. When consuming alcohol, it slows down your brain and the parts that affect your thinking and behavior. It also can affect your breathing and your heart rate. So there are different names for alcohol, including wine, beer, ciders, etc. But there's also street names. Some of them would be booze, brew, chug, cold one, gargle, goof, giggle juice, hard stuff, hooch, jack, Kool-Aid, mouthwash, poison, refreshment, sauce, shine, swish, or vino. There's many more. These are only just a couple. Alcohol affects your brain. It affects your brain by making it difficult to walk. It affects your vision, so you could have blurred vision. It affects your speech, causing you to have slurred speech. Slowed reaction times. An example of this would be if someone hit you in the arm and you were drinking alcohol, you'd probably have a slower reaction, or it would hurt a little later on than it would if you were sober. Alcohol can affect your memory. It can affect your mood change and behaviors. And when someone is drinking constantly and heavily, after a long period of time, those simple slips of forgetting can cause permanent damage that can require a lifetime of care. Impacts of your body. Alcohol doesn't just affect your brain, it affects your body as well. This can include your effects of your heart. So it'd be high blood pressure, stroke, cardiomyopathy, sorry guys, can't really pronounce, which just means stretching and dropping of one's heart muscles. It also can cause irregular heartbeat. It can affect your liver, creating a fatty liver, alcohol hepatitis, which is inflammation of the liver, fibrosis, the thickening and scarring of connective tissue, and it can cause chronic diseases of the liver. It affects your it can affect your pancreas. Sorry guys, too many things going through my mind right now. It can be a dangerous inflammation and swelling of the blood vessels, preventing proper digestion. Alcohol can also increase your risk of getting cancer. It could be your mouth, throat, liver, breast, etc. And it affects your immune system. Consuming a lot of alcohol frequently, or even a lot in one sitting, which is declared binge drinking, can weaken your immune system, making you an easier target and your body when the common cold is going around. It can also increase your risk of pneumonia and tuberculosis. Administrating alcohol is orally. Some usually drink it through the mouth. Eliminating alcohol from your body can be one of three. It can be urination, vomit, or perspiration, which is sweat. So the duration of alcohol. So the total duration is 1.5 to 3 hours. The onset of alcohol is 15 to 30 minutes. The coming up, so starting to get that feeling, would be 15 to 20 minutes. That steady feeling as though you're intoxicated, drunk, would be 30 to 90 minutes. Coming down from being drunk and starting to settle down is 45 to 60 minutes. The after effects can be 1 to 2 hours, and the hangover day after can be 1 to 36 hours. So is it really worth it? The signs of symptoms of someone when they have been drinking. So one, the way they talk to someone. So talking too loudly, slurred speech, aggressive speech, speaking slowly, or a big one is repeating themselves. You can also tell by their eyes. Their eyes are either glossy or bloodshot, droopy eyes, or a common one is when they're having trouble keeping their eyes open. Motor functions is a big one as well. They can't perform normal tasks as easy, like walking straight, which is a big one that police officers will use when they're trying to test your alcohol level, see maybe where you're at. Also, spilling drinks and fumbling is really common for people that have been drinking. Another thing is the way they interact with someone, with other people. So inappropriate behavior like rude remarks or being very flirtatious, poor judgment with someone is common as well. And mood swings is a big one for signs and symptoms. When they go from happy to angry to sad to happy, they're everywhere. So patterns of use when it comes to drinking alcohol. So one of them is binge drinking, where an individual consumes a lot of alcohol excessively. This is classified as more than 5 drinks for men and 4 drinks for women. This is mostly seen in college and university students, but it also can be for all ages. It's not just college and university students. It could be high school students. It could be adults. It's not just high school students. College students, sorry. Social drinkers are individuals that occasionally drink. They rarely go above the recommended limit to drinking. These individuals could go weeks, months without drinking or consuming anything of alcohol. If they were told by a doctor that they need to stop drinking because it could worsen in a health effect or something, they would have no problem with it. There's also alcohol abuse and alcohol dependency. So alcohol dependency is when you depend on that alcohol for talking to someone, going to work, getting up in the morning, etc. Alcohol abuse is abusing the alcohol, creating problems with relationships, with your family, with work, etc. Physical indications of someone who has been drinking. So at first it can start off with blackouts, losing memories of events that have happened, accidents or illnesses you can't explain, stomach cramps. Later on it goes to not feeling hungry or not eating, tiny blood vessels on skin looking like spider webs, swelling and redness in the palms, and especially in the face and the cheek, especially the nose and the cheeks, repeated skin sores, infections like blisters, boils, pimples, etc. Less interest in sex is a big one as well. Men might notice shrinking of the testicles and erection difficulties. Sore, upset stomach is also common. Feeling of numbness and tingling in the feet and hands. Unsteady when on feet, and liver problems. Psychological indications. Psychological indications would be craving for the substance increases. So it's not just, oh, I want to drink on the weekends. It's, you know, I want to drink after work every day, or I need to drink after I've had a bad day, or I need to drink to have fun, or etc. Anxiety when thinking that you would have to remove alcohol from your life. Loss of appetite, feeling of inability to cope without alcohol. So like you have trouble when you have to do something without having that alcohol as your backup. Denies that there's even a problem is a very common one. Usually someone who parents might be worried about. They will deny that they even have a problem. Feeling of restlessness when not consuming alcohol. An obsession with maintaining alcohol. So always kind of needing it to make sure you have it for backup. My computer's gonna die. Anxiety of thought of not having the substance, develop insomnia, mood swings, physical damage on the brain leading to memory loss, personality changes or confusion. If the individual, a big thing is if an individual has received help but has not admitted that they have a problem, they're more likely to crave and think about alcohol. But if someone is receiving help and has admitted that they have a problem, the cravings become less frequent, but they can still happen unexpectedly. Sorry. Symptoms of withdrawal. Symptoms can occur within 8 hours of one's last alcoholic beverage, or even days later. Symptoms usually start by 24 to 72 hours, but can last for weeks. Common symptoms include anxiety, nervousness, depression, fatigue, jumpiness and shakiness, irritability, mood swings, nightmares, not thinking clearly, clammy skin, dilated pupils, insomnia, rapid heartbeat, appetite loss, pale appearance, sweating, shaking, quivering of just the hands or the feet. Severe alcohol withdrawal can include agitation, fever, seizures, seeing or feeling things that aren't even there, and severe confusion. Dangers associated with alcohol. Becoming a victim of a crime, example, rape, domestic violence, mugging, assault, or being involved in a crime, theft, fighting, domestic violence, vandalism. Also having an accident happen, whether it's a physical accident, like a fall and you break your arm, or a road accident, drinking and driving, a work accident, or even an accidental fire. Loss of your job can be a danger of alcohol as well. Repeated absences from work, a poor work performance, that's a big one. Damaging relationships would be damaging family relationships with your parents or your partner or your children, or even with your friends you've been with for so long. You can damage that because of what alcohol can do to your body or your brain. Also, mental health concerns are a big one, and sexual health concerns are a big one too when it comes to alcohol. Effects of an overdose. So alcohol can go from one night to a slurred speech, to the loss of a balance, but then to a coma, or to death, depending on someone's drinking experience, their age, their gender, or even the amount they've eaten that day, or what they're drinking, can be turned into a harmful drinking time. Alcohol poisoning can occur when there's too much alcohol in the bloodstream and the brain isn't able to control the basic life support functions, including breathing, heart rate, temperature control, and these basic life support functions begin to shut down. Alcohol poisoning affects, it could be choking on one's vomit, breathing slows down and becomes irregular or stops, heartbeat becomes irregular or stops, too low of blood sugar, which is causing seizures, untreated severe dehydration from vomiting, which can also cause seizures, permanent brain damage, or even, unfortunately, death. How health professionals are to diagnose alcoholism, a problem with alcoholism and alcohol. So alcoholism, also known as alcohol dependence, early stages would be problems with that occur while drinking, including embarrassment over their actions and loss of control while drinking. This can progress to uncontrolled consumption of alcohol, despite knowing that it can affects you in a negative way, whether it's with your family, with your friends, or even in your social settings, where a place you go every day. Example, a restaurant. The later stages are alcohol becomes a threat to the individual's happiness, well-being of one's family, co-workers, and everyone else who is involved in their life. Even though there is not a specific test to diagnose alcoholism, healthcare professionals diagnose this addiction by doing screening tests or other tests that might identify a problem. They will also go through your medical history, family backgrounds, including with mental health, mental illnesses, just to get a background information on where you're going and how you're getting there. They also will probably do a physical examination. The physical examination will include lab tests to evaluate the individual's general health and determine if the individual has a medical condition or have a mental health symptoms. So there's not a specific test. It's all built up into one. Alcohol can be a risk during pregnancy. This would include drinking while being pregnant can harm the developing baby. If drinking alcohol while pregnant, then the alcohol can pass through the mother's bloodstream and into the baby's. Drinking can affect the baby's growth of cells. The brain and the spinal cords are most likely to get damaged with consuming alcohol, fetal alcohol spectrum disorder is a disorder that the mother's baby could have if she was to drink while carrying the baby. FASD can affect the baby's physical and mental ability, causing them problems that last them a lifetime. This can include distinctive facial features, a small head, flat face, narrow eye openings. Narrow eye openings are more distinctive by the age 2 or 3. Growth problems, a child with FASD may be smaller than another child and they could be the same age. Learning and behavioral problems is a very common one, whether it's a mild case of FASD or a severe case of FASD. Birth defects is also one. And alcohol FASD can also include causing problems when feeding or bonding with the baby. But individuals who drink heavily during pregnancies are at risk of causing a miscarriage, a stillbirth, or a baby being born too early. Risk of HIV when consuming alcohol. Particularly binge drinking can increase your risk of HIV due to making unclear choices and decisions. Being drunk affects your self-consciousness, which may lead to you making risky decisions that you normally wouldn't make when you were sober. This would include you having sex without a condom. Risk factors of drinking alcohol. As an individual, beginning at an early age, risk-taking behavior, coping skills and poor social skills, early childhood and behavioral problems, feeling isolated. Family would be a history of use, inconsistent parenting, supervision, nurturing, or discipline, unclear rules, expectations, and unclear rules and unclear expectations and consequences, confliction and experiencing difficulties within the family, fighting with parents, going through a divorce, a death in the family, etc. With your peers, usually associating yourself with someone who is into alcohol or drugs as well. With school, you have difficulty in school, whether it's through fitting in or the schoolwork itself, or there's no commitment to school, like after school activities, or feeling that you don't belong. Through the community, alcohol is accessible, like easily. So if you just went up to someone on the street and said, "Oh, like, can you buy me alcohol?" then it's easily accessible. Unfortunately, in a poverty neighborhood, it's common as well, and favoring drug use, not really putting a stop to it. Protective factors of alcohol. So with an individual, would be a sense of self-esteem, a well-developed social skills and problem-solving skills. With family, good communication. Mostly your family could sit down, talk to you about substance abuse, and what comes with getting into alcohol and drugs. Supervision of the child and their activities, including who they're friends with. Rules and expectations are clear and enforced, and the youth feel connected, valued, and supported with their family. When it comes to peers, their friends don't do drugs or alcohol. Having one or more best friends is really helpful. You're able to rely on those friends for emotional support and stability. Sorry. When it comes to school, you have success and commitment in school. You're involved in extracurricular activities like basketball after school. School takes action when it comes to drug use and alcohol use, and they make it clear that they are there to help. And in the community sponsors activities, strong social bonds, and the youth feels connected within the community. And yeah. Oh, sorry guys. Oh, no. Okay. Two treatment programs, for individual that is having difficulty. So Women of Sobriety is a good one. It's a non-profit organization where the women become sober and stay sober. They use this New Life program, which helps women, helps them with using positivity and encouraging emotional and spiritual growth to help them overcome their addictions. This program helps women get their lives back on track, as well as keep them positive and healthy. Another one is moderation management. This is the first moderation based program. This helps individuals take responsibility for their actions, what alcohol has done for them. This is a support group that doesn't make you just quit drinking and stop. It helps you slow down. It teaches you also the signs and symptoms if you were to get back into alcohol. This program is supportive and helps you take step by step. It doesn't make you quit right off the bat. It helps you learn to moderate yourself and your drinking. So that's my presentation. I hope you guys enjoyed it. I'm sorry if I was a little nervous or anything. But feel free to do the word searches in the true or false, and we can take them up after. If you guys have any questions, I'd love to try and answer them. I'm not an expert or anything, just trying. But thank you guys. I really appreciate it.